Imagine yourself in a hospital bed. The sounds are unfamiliar. The constant, rhythmic beeping of machines, the hushed but urgent voices in the hallway, the squeak of cartwheels. The room feels cold and impersonal, and the thin blanket does little to comfort you. You are surrounded by strangers, even though they are here to help. In this moment, you are more than just a diagnosis or a chart number. You are a person feeling scared, vulnerable, and profoundly alone. This feeling of isolation can be as difficult to endure as the physical ailment that brought you here. It's a heavy weight that can slow down healing and make every day feel like a struggle. The medical procedures are necessary, but what the heart craves is a human connection. Now, picture a nurse walking into that room. They don't just check your vitals and move on. They pause. They look you in the eye and ask, "How are you really feeling today?" This simple question, asked with genuine care, can change everything. Suddenly, you are not just a patient, you are seen. This is the power of empathy in action. It is the ability of a healthcare provider to step into your shoes, to try and understand the fear and uncertainty you are experiencing. This act of understanding doesn't require complex medical equipment. It requires something far more fundamental, a recognition of shared humanity. It is this connection that begins to bridge the gap between fear and comfort, transforming the sterile hospital room into a place of healing. Empathy is the invisible medicine that works alongside prescriptions and treatments. When a doctor takes a few extra minutes to sit down and explain a diagnosis in a way that you can understand, they are not just sharing information. They are acknowledging your worries and empowering you with knowledge. They are showing you that your feelings matter. This compassionate approach has a real, measurable impact. It can lower a patient's anxiety, reduce their perception of pain, and even improve their body's physiological response to treatment. Feeling understood and cared for can give a patient the emotional strength they need to face their health challenges with renewed hope and resilience. It turns the daunting journey of illness into a partnership between the patient and the provider. The foundation of truly effective healthcare is not built on technology or advanced procedures alone. It is built on trust, and trust is a direct result of empathy. When patients feel that their doctor or nurse genuinely cares about their well-being, they are more likely to follow medical advice, ask important questions, and be honest about their symptoms and concerns. This open communication is critical for accurate diagnosis and effective treatment planning. An empathetic connection ensures that the care provided is not just technically correct, but also tailored to the individual's emotional and personal needs. It reminds us that healing is a holistic process, involving the mind and spirit as much as the body. This is the essence of patient-centered care. It is important to understand what empathy truly is, because it is often confused with its cousins, sympathy and pity. While all three stem from a place of concern, their impact on a patient is vastly different. Pity is looking down from a distance, feeling sorry for someone's misfortune. Sympathy is standing beside them, acknowledging their pain and saying, "I'm sorry you're going through this." Empathy, however, is the most powerful of all. It is the act of trying to feel with them. It's the ability to say, "I can imagine how difficult this must be for you, and I am here with you." It's about connection, not separation. A patient doesn't want to be pitied, they want to be understood. Think of it this way: sympathy creates a space between people. It says, "Your problem is over there, and I am over here, feeling bad for you." This can sometimes make a patient feel even more isolated in their struggle. Empathy, on the other hand, closes that space. It builds a bridge. It requires active listening and a genuine attempt to grasp another person's perspective without judgment. A doctor showing sympathy might say, "That's a tough diagnosis." An empathetic doctor might say, "Hearing this news must feel overwhelming. What is going through your mind right now?" The second response opens the door for a real conversation, validating the patient's emotions and making them feel supported in a meaningful way. The components of empathy in a clinical setting are quite clear. It starts with perspective taking, the cognitive effort to see the world from the patient's point of view. This is followed by understanding their feelings without getting overwhelmed yourself. Finally, it involves communicating that understanding back to the patient, both verbally and non-verbally. This could be through a gentle touch on the shoulder, maintaining eye contact, or simply nodding as they speak. These small actions send a powerful message. I hear you. I see you. You are not alone in this. It's a skill that goes beyond textbooks and lab results, yet it is just as vital for a positive health outcome. In practice, this distinction is critical. A patient who receives sympathy might feel grateful for the kindness, but a patient who experiences empathy feels empowered. They feel like an active participant in their own care journey. The empathetic healthcare provider doesn't just treat the disease, they care for the person experiencing the disease. This shift in focus from what's the matter with you to what matters to you is transformative. It ensures that the treatment plan respects the patient's values, fears, and hopes. This deeper level of connection is what separates good medical practice from truly great human-centered healthcare. Empathy is not a fixed trait that some people have and others don't. It is a skill, and like any skill, it can be developed and strengthened with intentional practice. For busy healthcare professionals, finding ways to cultivate empathy amidst the chaos of a hospital or clinic is essential. One powerful tool is mindfulness. By taking just a few moments to center themselves before entering a patient's room, doctors and nurses can clear their minds of distractions. This allows them to be fully present, to listen more deeply, and to observe the subtle cues in a patient's body language and tone of voice. This presence is the first step toward a genuine connection. Another effective method for building empathy is through structured training, such as role-playing exercises. Medical students and professionals can practice navigating difficult conversations, like delivering bad news or discussing end-of-life care, in a safe and supportive environment. By playing the role of the patient, they can gain first-hand insight into how it feels to be on the receiving end of care. This experience can be profoundly eye-opening, helping them understand the emotional impact of their words and actions. These simulations build muscle memory for compassion, making it a more natural response in real-life situations. It's about rehearsing kindness until it becomes second nature. Mentorship also plays a crucial role in fostering an empathetic culture. When experienced doctors and nurses model compassionate behavior, they set a powerful example for their younger colleagues. Openly discussing the emotional challenges of the job and sharing strategies for connecting with patients helps normalize these conversations. A senior physician who takes the time to sit with a patient and their family demonstrates that empathy is not a luxury, but a professional standard. This guidance helps new professionals learn that technical proficiency and compassionate care are not mutually exclusive. In fact, they are two sides of the same coin, both essential for healing. However, we cannot talk about empathy without addressing the risk of burnout. To consistently offer compassion to others, healthcare workers must also practice self-compassion. The emotional toll of caring for the sick can be immense. Hospitals and healthcare systems have a responsibility to support their staff, providing resources for mental health and ensuring manageable workloads. When providers are exhausted and overwhelmed, their capacity for empathy diminishes. Protecting the well-being of our healthcare heroes is not just good for them, it is essential for ensuring that patients continue to receive the kind, attentive, and empathetic care they so desperately need and deserve. The positive effects of empathy ripple throughout the entire healthcare system, leading to better outcomes for everyone involved. When patients feel a strong, trusting connection with their provider, they are more likely to adhere to their treatment plans. This improved cooperation can lead directly to better health results, faster recovery times, and a higher quality of life. Furthermore, an empathetic approach significantly enhances patient satisfaction. People who feel heard and respected are more likely to report positive experiences with their care, which is a key metric for the success of any hospital or clinic. Happy, trusting patients are the hallmark of a healthy system. Moreover, empathy is a powerful tool for reducing medical errors and healthcare costs. A provider who listens carefully, is less likely to miss a crucial piece of information that could lead to a misdiagnosis. Patients who trust their doctors are more willing to speak up if something doesn't feel right, providing an essential safety check. This collaborative environment can prevent costly mistakes and reduce the likelihood of malpractice claims. When communication is clear and compassionate, misunderstandings are minimized. In this way, empathy is not a soft skill, but a critical component of patient safety and financial responsibility. It is an investment that pays dividends in both human and economic terms. To make this a reality, empathy must be woven into the very fabric of medical education and hospital culture. Medical schools should move beyond teaching just the science of medicine and equally prioritize the art of human connection. This means integrating empathy training, communication workshops, and humanities courses into the core curriculum. Hospitals, in turn, must champion empathy as a core value. This includes recognizing and rewarding compassionate care, providing ongoing training, and establishing systems that support rather than hinder meaningful patient interactions. Leadership must set the tone, demonstrating that how a patient is treated emotionally is just as important as how they are treated medically. Finally, patients and their families have a vital role to play in this transformation. By providing honest and constructive feedback about their experiences, they can help healthcare providers and institutions understand what is working and where improvement is needed. Sharing stories of both compassionate and impersonal care can be a powerful catalyst for change. When we all work together, providers, educators, administrators, and patients, we can build a healthcare system where empathy is not the exception, but the rule. The ultimate message is simple but profound. Medicine at its best is a blend of science and soul. Understanding and kindness are not just courteous gestures, they are essential ingredients for healing.